Welcome to our presentation on sexually transmitted diseases among the elderly. We hope you learned something new today. It is a common misconception that sexually transmitted diseases, STDs, and sexually transmitted infections, STIs, are a problem faced largely by teenagers and young adults. The reality is, STDs are rising in individuals age 60 and older. Research has shown that STDs are increasing in older adults as a result of risky sexual behaviors, including lack of condom use and decreased monogamy. Although research and data analysis have shown a rise in STDs among older adults, STD testing rates remain low among this population. According to literature review, healthcare providers are omitting a vital aspect of the comprehensive geriatric assessment, a sexual history, and are missing opportunities to identify and screen patients at risk for STIs. The purpose of this project is to highlight the importance of this issue in today's society, to explore evidence-based strategies nurses can utilize when discussing sexual health with this population, and provide education about safe sexual health habits. Sexual health and sexuality have been shown to be an important indicator of quality of life among older generations. It is a topic that is often overlooked and under-discussed by healthcare providers. Nurses play a role in this public health issue, so how do we tackle it? STIs such as chlamydia, gonorrhea, and syphilis are on the rise among older adults. However, only 1 in 3 older adults at risk have ever received STI testing. Less than 20% of heterosexual people aged 57 to 85 years old have ever been tested for HIV. Timely screening and treatment is essential as older adults are more likely to experience late-stage diagnosis. Healthcare providers report being reluctant to discuss sexuality and STI-related topics with older adult patients. However, research by Farrell and Belka stated that providers worry about embarrassing or offending their patients, even though older adults report being unlikely to be offended or embarrassed if a nurse were to bring up sexual health. So why are STIs on the rise among older people? Research suggests that thanks to products such as Viagra, older people are having fulfilling sex lives well into their 80s. On a study conducted of people over the age of 50, only 12.5% of those folks reported always using condoms. Lack of condom use in older adults is usually linked to infertility and lack of knowledge. Folks who can't get pregnant think there's no reason to use a condom. There's also a lack of monogamy that happens after the divorce of a couple or the death of a spouse. The CDC tracks and reports incidences of STIs. Here are some stats to show the rise of 3 common STIs, chlamydia, gonorrhea, and syphilis, among older adults. Older adults who are sexually active should talk to their healthcare provider about STI testing. Screenings for STIs should occur once a year for sexually active older adults, and all adults should be tested at least once in their life for HIV. Trichomoniasis testing should be conducted at least annually for all women who already have HIV. Farrell and Belka also noted that most older adults identified as being willing to discuss their sexual health with their providers, but feel that nurses should be the ones starting the conversation. So one way for nurses to combat the rise of STIs in older adults is to have open and honest communication with our patients. Research shows that our patients expect that of us. Nurses are missing opportunities to connect older adults to education, referrals, and support by never inquiring about sexual health. So what are some of the implications for our profession? We need to identify older adult patients at risk for developing STIs. This includes community dwelling adults, nursing home residents, folks who live in assisted living, and long-term care. We need to recognize our personal biases and attitudes about sexuality in older adults, recognize that each older person has unique preferences and sensitivities when discussing sexual health, and use those unique preferences to develop our care plans and communication strategies. We must develop therapeutic and empathetic relationships with older adults to build trust and allow for open communication. We must recognize that sexuality is a potential indicator for quality of life for some older people, and to develop strong and effective communication skills, as this is an important factor in discussing sexual health. Nurses can play an even bigger part in sexual health education by increasing personal and public education to reduce the stigma of STIs, to reduce homophobia and ageism in healthcare. We must educate older adults on safe sex practices, the risks for acquiring STIs, and prophylaxis strategies. We must recognize the potential impact certain health conditions and medications have on folks' sexual performance and their health. We must provide referrals, social support, and educational materials. We must target HIV prevention efforts targeted towards older adults. We must remove personal bias and attitudes when determining who needs STI testing. We must promote more qualitative and quantitative research on STIs and HIV among the elderly. The burden of initiating the conversation about sexual health should be lifted off the older adult and placed on the nurse, whose role is to facilitate the best health outcomes possible for our patients. For further reading or to review our references, take a look at these articles. We hope you have all learned something valuable today and are able to incorporate this knowledge into your daily nursing practice. Thank you!